Hi everyone, I hope you can all hear me well. I'm here to talk about the gynecologic examination and really the practical sessions in this course, a little bit of the content around them and how you can prepare yourself for these practical sessions. We prefer to use the term gynecologic examination or pelvic examination. It's a more inclusive term because we know that some men do have uteruses or uteri and have vaginas and all that stuff. So sometimes men need PAPs, and so if we use the term gynecologic exam, that would be more inclusive. So for today, we're going to talk a little bit about the gynecologic practicals and the exam, which is the last practical session. We're not going to spend too much time talking about that because we did talk about that at the first class last week. We're going to talk about some of the tests that can be done during a gynecology examination. I'm going to let you know a little bit about the video and how you can use that to prepare for your sessions. We're going to go through some commonly asked questions about the exam and some troubleshooting techniques. And I'm going to talk a little bit about how and when and where you can incorporate this exam into your private practice. It does have a lot of clinical utility in clinical practice. We'll talk a bit about that. Okay, so the practical sessions, again, there's 3 sessions. I think you can read this stuff. We talked about it last week. It's also in the course outline. Note that the marking rubric is posted to Moodle, so that's actually a really handy step-by-step tool that you can use to prepare for your practical examination. So the first station, station 1, is formative, again, which means that it's not being formally evaluated. It's more for to develop your skills. It's with a plastic pelvic simulator. You're scheduled for an hour. There's a demo, and then you get to practice with the speculum. You get to practice the external exam, ask any questions you might have. Really, this is a session to help you prepare for your session with the live gynecology model. Station 2 is also formative. It's on a full exam on a live model with TA support. As I mentioned before, that the models are often CCNM students years 1, 2, and 3, which sometimes makes for scheduling challenges, especially if you know somebody in one of those years very well. That's why we asked for advance notice if you need to do a switch. There is a live demo every evening. Check the schedule to be sure, but they're often at 4:30 p.m. just before every practical session. The attendance is optional at the demo, but we strongly recommend you attend. It will help you so much in your practical session. And then the third session is a formally evaluated session using the same rubric that you used in the second session, and that rubric will be a tool for feedback in that second session, and this third session will be a tool for evaluation. You need to achieve a minimum of 65% to pass the practical, but there are some criteria for automatic failure, which are potential or actual harm to a patient. So let's say you were about to remove the speculum open in the open position, which can happen sometimes. It's pretty painful. Your TA would let you know and would obviously stop you from doing that, but had they not been there, you might have continued to do that. So in that case, you could probably fail the exam. Or also repeated contact with structures such as the clitoris, which would be inappropriate, obviously. And then there's a global assessment in addition to the point system and the automatic failure. The global assessment basically says like how you perform the exam overall. And it's pretty straightforward, and if you look on the evaluation form, you'll see that. We talked about switches. Please email Amber Moore, Dr. Moore directly. Okay, so let's talk about how to actually prepare for your practical. What I really recommend doing is, and I find this personally really helpful when I'm learning a new skill, is different sources of information. So we have the Pelvic manual, which I will post on Moodle. And that's a manual that I wrote, which is very specific to how we do the examination here at CCNM. And then the marking rubric, and also going over the Gyne video, which was also created here at CCNM. So those are all really helpful tools to help you kind of prepare. You'll see that our marking rubric is very detailed, and it breaks the exam into steps: setup of the room, verbal communication, patient setup, external examination, on, and each step is broken down. And so this is, as I mentioned, a really good way for you to prepare for the exam, because it really breaks the exam down into bite-sized pieces. So the gynecology exam video is now available right on Moodle. You can just ignore these instructions here. I posted it on the Moodle page at the top of our course. It's a great guideline, but it doesn't exactly match the rubric, so when in doubt, go with the rubric. Other practical tips on how to prepare: clip your nails, make sure they're short. You may be asked to do that on site if they're not short. Can't wear acrylic long nails during a gyne exam, unfortunately. You'll come to see that being a naturopath usually means you have really boring short nails, often with like no fun nail polish on them. Remove your rings, bracelets, and watches, and make sure your attire is professional, so clinic attire. And I mean, you're free to obviously wear whatever you want, but I would recommend that skirts probably are not a good idea, because our table is really awkward, and it makes wearing skirt awkward, and that's like the best way I can describe it at this moment, but you'll know what I mean. You can't really, you kind of need to separate your legs really wide in order to do the exam. So that might be awkward if you're wearing a skirt. Dr. Moore or your TA will talk to you about all your stuff, but try not to bring too much stuff to the practical. There's not a lot of space. And please come early. Sometimes the sessions are running early, and in which case you can get started and then leave early, which is great for everybody. Okay, in terms of the exam itself, we designed the whole gyne exam curriculum across the years at CCNM, and in second year we tried to focus on patient rapport, draping, patient positioning, some basic speculum skills. The third year curriculum incorporates the learning objectives from second year, but also includes all of these things you see below: speculum, sample collection, assessment, and diagnosis, certain advanced techniques, although they don't always come up in the practical exam. And then I'm going to talk a little bit about bringing the exam into your practice. One thing that we really want to emphasize, and this can be challenging when we're trying to learn a new skill, sometimes we're not aware of what we're saying and how we're speaking, but your language does make a huge difference to the sort of emotional, mental well-being of the patient. So I encourage you to go through this list. Just quickly, I mean, if you think about telling your patient to take off your clothes, get onto the bed under the sheet, versus, I mean, that obviously has sexual connotation. If you were to say, please change out of your clothes, or please change, remove your, blah, 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 everything but your bra or your shirt, put on the drape with the opening to the back, sit on the table, and put the drape over your legs. That's much less triggering language. So I encourage you to go through these terms here. Another one that we hear a lot is putting in, taking out, pulling out. Better to say insert, remove, for obvious reasons. That's a biggie. And then just your language around your observations. So things looking healthy and normal versus things look great, or, you know, everything looks wonderful. Using more neutral terms will make a patient feel more comfortable. And I'll tell you from experience, patients who are coming to us, naturopaths, for pelvic examinations are usually patients with some kind of history around the examination, something that, or some kind of sexual trauma, something that makes them uncomfortable with doing the examination with their family physician or gynecologist. So it's especially important for us to be aware of our language. This is just a list of things that I put this list together many years ago when I was pulling together all this stuff for exams in my practice. It's something useful to have. I just want to especially draw your attention to this particular biohazard container. It's the 10.3 liter container with this wide mouth. It's the only container that will fit speculums. Okay, so here this year, in the past few years, we decided to move the training to regular examination tables, because what we found is that in clinical practice, a huge barrier to doing these exams was that, you know, students learned a specific way on very specific tables at CCNM, but then obviously didn't go and purchase these very expensive tables for their practices. So we're really trying to emphasize that you can do these exams on just a regular exam table. And we'll show you a little bit of how to do that. We're not going to get into this, but this is the stuff you need to have nearby. Make sure it is nearby and within reach, your garbage, all of your disposal stuff. So let's go through the actual tests that are available. So the first is a vaginal swab. It's a general culture swab that we use in the vaginal canal. You can, you know, in clinical practice, use it all kinds of places in the body. In this exam, we use it in the vaginal canal. So in the vagina, it tests for specific vaginal bacteria, it tests for Candida species, and it tests for Trichomonas. You swab the vaginal canal, not the cervix, so you're swabbing the lateral fornices, so those little pockets between the vagina and the cervix, and the vaginal walls. You can collect any specific discharge if you see it. And you'll see about how to do this exam, this test in your station 1 as well. Keep in mind that this tube, once the swab is collected, can be kept at room temperature for a little while, so you don't have to keep it in the fridge after you collect it. Now this part is black, so what you need to do is pop off this to put this in. Some students the first few times will try to stick this right in here. That's not going to work. Just a handy little tip for the first time that you do that. So this swab we can no longer run in Ontario under CONO regulations, but it's a swab that tests for chlamydia and gonorrhea. It's an endocervical swab because that's where we know that chlamydia and gonorrhea live. So basically you would have, or if you are practicing in an area where this is available to you, you take this swab into the endocervical canal, kind of swab up some of the discharge, and then use this swab. And there is a way, I think you have to turn it a certain number of times, and that number is escaping me right now. I think it's 5. And then there's the Pap test. So we can still do PAPs in Ontario. The Pap test looks for abnormal cervical cells, but it does not confirm the presence of HPV, at least not automatically, and we can't test for HPV DNA anymore anyway in Ontario. So it's an endo and ectocervix swab. You'll see the broom is such that it fits both into the canal and onto the face of the cervix. You insert it, And then while some of the bristles are still touching the face of the cervix, rotate clockwise 5 times. You remove the cap from the jar and then kind of pop off the top with your thumb. Be careful, it can, if you're not doing it in a controlled kind of manner, kind of pop off and shoot across the room. And this test should not be refrigerated, and it can sit at room temperature for quite a long time. I'm not going to get into this. You can read it. It's a way to collect tests for HPV DNA. We cannot do it in Ontario anymore. pH. So this is a test that has quite a bit of clinical utility. I use it a lot. Using a specific range of pH paper from 3 to 5.5, and using it on really the best place to collect a pH sample is once the speculum has been removed. On the lower extension of the speculum, there tends to be a little pool of discharge or vaginal secretions, and you can put the paper swab, the piece of paper into there, just dip it into that pool of secretions. But keep in mind, if you've used lubricant, it can throw off the pH reading. So you really want to do that without having used lubricant. Blood or semen can also significantly change the vaginal pH, right? Because vaginal pH is typically very low, normally between 3.8 and 4.5. So if semen having a fairly neutral pH, it will change the pH quite a bit. So keep that in mind. All right. Have a chance to go through the Gyne video on your own. It's posted on Moodle. And we're going to go through some frequently asked questions, things that come up or things that might be useful to you in your clinical practice. So in terms of patient instructions, what do we want to tell our patients prior to a gyne exam? Avoid exam during very heavy menstrual bleeding because it may interfere with some samples. Probably not the Pap, but still. There should be no sexual intercourse for 24 hours prior to the exam, and no use of douching creams, salves, etc. And really, a lot of the reason about this has to do with if there is semen in the vaginal canal, it can impact the swabs. Also, lubricant is bacteriostatic often, so it may disrupt the culture swab. And how can we minimize discomfort for the patient? Give her a sense of control over the exam. So really let her know what she can, or let the patient individual know what they can expect, and allow the patient to have control over the exam. So if the patient knows all the steps of the exam, which you'll tell the patient prior to the examination, then during the examination you'll refer back, oh, now I'm going to move on to this speculum exam as we discussed, or I'm going to move on to the bimanual exam like we talked about, so they know what to expect. Check in a couple of times. How are you doing? Not, is this painful? Is this hurting you? How are you doing once or twice? You don't also want to check in too much because it can also increase the anxiety level in the room. And then you can give your summary of findings at the end of the exam or briefly at certain parts during the exam. But if there's something you need to discuss at length, it's probably better to have the patient change and then discuss the findings at the end. In terms of minimizing discomfort during the speculum exam, there are a couple of tricks. One of them is just really watching your angle of the insertion of the speculum, making sure it really is on that 45-degree angle, and then really following the posterior vaginal wall. So kind of putting like a gentle pressure on the posterior vaginal wall can really help increase the comfort level. As you're inserting the speculum too, you want to really make sure that the labia don't get pulled in with the speculum. It does happen, so just carefully remove the labia as you're inserting the speculum, and that can help really to minimize the patient's discomfort. How to do a recto-vaginal exam. There is you'll see this in the video. We're not going to practice this, but it can help palpate a retroverted uterus. If the uterus is retroverted, you can really only, it's kind of sitting back there in the pouch of Douglas, so you can really kind of only feel that through the rectal wall. So you insert one finger into the rectum and one into the vagina, assess the rectal wall. You can look for, if you're concerned about endometriosis, you can also look for adhesions on the recto-vaginal wall or the septum. That can be a useful tool in certain clinical situations. I don't do them very often. All right. What to do if you have trouble inserting the speculum. Really focus on separating the labia minora using your two fingers, your index and middle finger. Actually make contact with the labia minora with those two fingers. So some students tend to not just separate open the introitus with their index and middle finger, not actually making contact with the labia minora. You really have to hold the labia minora to prevent them from being pulled in. And we talked about the labia getting pulled in. What happens if you can't find the cervix? So this does happen maybe 20% of the time, maybe slightly more. Sometimes, so now with our new fancy specs, we can really kind of see where we're going. When you're inserting the speculum, compared to the metal specs, these ones are great because they're illuminated, and almost like the tip of the speculum is it's like a guiding light. You can really see. So look for tissue texture changes in the vaginal canal as you're inserting it, and when you see that smooth tissue of the cervix, then you know you're kind of getting ready to open the extensions. Although just make sure that the speculum is fully inserted before you open the extensions. Sometimes if you can't really see the cervix and you open the extensions and you just kind of take your hand off the speculum altogether and let everything sort of settle into place, the speculum will pop into view, and the cervix will pop into view. That happens quite often. Now let's say you really, really can't find the cervix. So what you can do at that point is remove the speculum, take one finger, either lubricate it with gel or with water, depending on what needs to be done in the exam. So if you're doing a Pap, it's okay to use gel, but if you're doing a swab, you don't want to use gel. Locate the cervix with one finger, using a digital check. And that can help you really to kind of mentally visualize where the cervix is and sort of point the speculum in that direction. Sometimes the cervix is really in a place where we don't expect it to be, and it can be hard to find for that reason. Sometimes we can't see the cervix due to the vaginal wall kind of falling inward. This happened the other day in clinic. We really couldn't see the cervix. So we tried a large speculum, and that did work. The large speculum is wider, so that helps move the vaginal tissue out of the way. But another cool little trick, take a condom, a clear condom, cut off the tip, put it onto the speculum, and the sides of the condom should hold back the vaginal wall. I read this tip about using a cut glove. I've never used it. It seems really awkward and cumbersome, but something you can always try. For the bimanual exam, if you can't find the cervix, you can do a few things like bringing up your foot, or standing closer to the patient, or having the patient sort of put their hands, sort of making two fists, putting their hands under their sacrum to tilt the pelvis forward can often help. I'm going to let you read this one. It's pretty straightforward. Same here. It can be pretty challenging to palpate the ovaries. Often, it needs to be like a menstruating woman or a menstruating individual who's ovulating, who tends to have not a lot of adipose tissue. So then it can be easier to palpate the ovaries, but it's not always a given. We're going to move along. These are some special circumstances you might come across. We're going to just leave it. You can read those. So all this, how can we facilitate you to do these exams in practice? Keep in mind that a gyne exam doesn't have to be like the whole shebang. You don't have to do all 3 stages of it. Sometimes you just need to do an external assessment, or sometimes you just need to do a speculum examination, or sometimes you just need to do a bimanual examination. You can decide based on the clinical scenario, but it is really useful to have the option. So I very often will just do external exams in my practice. You know, women with vulvodynia or itchiness or just all kinds of things that even just an external exam can be useful. You already have a lot of the things you need in your practice, these things in particular. You probably don't have something to help raise the pelvis. So a wedge can help elevate the pelvis. It's pretty cheap and easy to buy. A biohazard or sharps container, as I mentioned earlier, also very easy to get. Specs of appropriate sizes. So you really need a lot of medium specs with maybe 1 bag of small and 1 bag of large. And then the speculum lights. So these lights are actually pretty affordable now, and they are really, really handy. Some lubricant, some pH paper, and long cotton tip swab. And that's really all the additional stuff you need. If you don't have a wedge, you could even use a stack of towels, which is something I did in my practice for a number of years. I'm going to show you how to do this. So basically, what does the gyne table do? It allows you to have some space below the buttocks of the patient so that you can insert the speculum without the handle kind of bumping up against the table. So the gyne wedge serves the same purpose by elevating the pelvis. So you can see here, this is like a wedge. You have the patient bring the buttocks to the edge of the table, bring the feet to the edges of the table, and you'll be able to insert the speculum. You can order your kits and tests and all that stuff from Life Labs. They can also often provide pickup of specimen, although I live, a block away from a Life Labs facility, so I can just have my patients walk the specimen over if necessary. Remember to keep in mind the storage guidelines. And then some potential differences between metal and plastic. Really, if you're not in a hospital setting or a large clinic setting that's already doing a lot of exams, you're going to be using plastic specs. Strongly recommend you buy these specific specs that are so much easier to use than the old school plastic specs that are basically atrocious. So anyway, these are pretty functional. They're actually excellent in my opinion, and they're not too expensive. And same with